Hi, everyone. Welcome to another episode of 15 Minutes with Dr. Makis, my new hard-hitting medical podcast. It is now pretty well established that Pfizer and Moderna COVID-19 mRNA vaccines cause extremely aggressive cancers called turbo cancer. They are gaslighting us about this. The medical establishment is burying their head in the sand. They're pretending that this phenomenon doesn't exist. We've got a Wikipedia entry that quotes an oncologist in the States, Dr. David Gorski, who has received funding for his blog from child sex trafficker Jeffrey Epstein. He's written big articles claiming that, this is a made-up phenomenon. But what you will find on social media is that thousands of people and their family members are reporting extremely aggressive cancers after taking Pfizer or Moderna COVID vaccines. The top five turbo cancers that I'm seeing, the number one is lymphoma, number two, brain cancers, glioblastomas, and then breast cancers, colon cancers, and lung cancers. We've seen recently the mainstream media starting to acknowledge that extremely aggressive cancers are showing up in young people. Of course, they're baffled. They have no idea what's causing it. They're not allowed to even hint that the COVID vaccines may have caused these cancers, but it's happening. There's thousands of stories everywhere. So the question is, how do you treat these cancers? One of the key features of turbo cancers is that they are resistant to conventional chemotherapy, radiation therapy, even immunotherapy. The treatments don't work. And so oncologists will give you the standard treatments. And when everything fails, they send you home to die. That's basically it. Your oncologist will not save you. They will not save your family member. They're going to protect their medical license. They're going to protect their job. And that's it. They will never recommend anything alternative. So it's extremely important that you have an alternative cancer treatment plan in place. I have been doing deep dives into alternative cancer treatments on Twitter and on my Substack. And so I'm going to be putting out a series of videos in terms of how you can approach these extremely aggressive cancers and give yourself a fighting chance to cure some of these cancers that are at stage 4 that oncologists can't cure. In this episode, I'm going to talk about high-dose ivermectin and treatment of aggressive cancers. Ivermectin has been vilified. It is a Nobel Prize winning drug that has been used as an antiparasitic for many, many years. Merck had it on patent until 1996. And interestingly enough, Merck said it doesn't work for COVID-19. Well, we find out now that Merck has a 50-50 partnership with Moderna on mRNA cancer vaccines. Merck is going to be making billions of dollars on cancer and mRNA cancer vaccines. So they have no interest in continuing to investigate ivermectin for cancer, for example, because it's cheap, it's off patent. They're not going to make any money on it. So there is tremendous amount of evidence that high-dose ivermectin is extremely effective in treating many types of cancers. And the way I approach this is I usually look at, okay, what are the mechanisms of action, for example? What are the mechanisms of action by which ivermectin treats cancer? So I'm going to show you a couple of papers that will look at the mechanisms of action, what the studies have been done in terms of maybe animal studies or human studies, looking at ivermectin and cancer. And then, because I get hundreds of emails and questions about this, what is the dosing? How do you actually treat cancer with ivermectin? So let's get started. The first paper I want to share with you is a paper from 2022 by an Iranian group headed by Dr. Loftidazeh. And this is a very interesting paper because it just summarizes in a nice way the mechanisms of action of ivermectin in cancer. It acts on these signaling pathways called PAC1 and ACT and mTOR and WNT pathways. These are pathways that are involved in tumor proliferation, tumor growth. And so ivermectin inhibits multiple of these pathways that inhibit tumor growth, tumor proliferation, leads to cell cycle arrest, And it also inhibits metastases and the ability of the tumors to create blood vessels for themselves. So that is key. Multiple pathways that inhibit tumor growth, tumor proliferation. Then ivermectin also acts on cancer stem cells. It inhibits cancer stem cells. And cancer stem cells are extremely important because they are involved in the aggressiveness of cancers. They're involved in metastases, and they're also involved in cancer recurrence. So imagine you get chemotherapy, you think you've been cured, but cancer stem cells tend to be resistant to chemo, and then your cancer comes roaring back because these cancer stem cells start proliferating again. So it inhibits cancer stem cells, very important. Ivermectin also stimulates cancer cell death, stimulates apoptosis, autophagy, other kinds of cancer cell death. Ivermectin also reverses multi-drug resistance. So if you develop resistance to certain chemotherapy, ivermectin will reverse it. And ivermectin acts in combination with chemo or radiation therapy. So it has those additional benefits as well. Another great paper is a paper by Guzzo from 2002. And this was basically a safety study on ivermectin. What kind of a dose of ivermectin can you take safely? So in this paper, they looked at 30 or 60 milligrams 3 times a week, or 90 or 120 milligrams as a single dose. And basically, the conclusion was that ivermectin was generally well tolerated with no indication of CNS toxicity. So this is neurological toxicity for doses up to 10 times the highest FDA-approved dose of 0.2 milligrams per kilogram. So 10 times that would be 2 milligrams per kilogram. Remember this number. They've shown that ivermectin is well tolerated up to 2 milligrams per kilogram per day. And the approved dose is, of course, as an antiparasitic. It's 200 micrograms per kilogram or 0.2 milligrams per kilogram. Well, you need a higher dose for cancer effects. So again, ivermectin generally well tolerated at these higher doses and more frequent regimens. So a very important study showing safety of ivermectin at higher doses. Next, you want to look at whether ivermectin has actually been used in cancer patients at the higher doses and whether those doses were safe. So a great paper on this is a paper by Claudio Castro back in 2020. And this paper looked at using high dose of ivermectin in children who had leukemia. One of the children was an 11-year-old boy diagnosed with an extremely aggressive leukemia, and they gave him 1 milligram per kilogram once daily, so per day, with chemotherapy. And what they showed was that he started feeling better, and the blasts, which were the leukemic cells, were cleared from his blood. Now, they only gave it for a short time with the chemo. Then, he eventually started getting worse again. So they resumed ivermectin 1 milligram per kilogram for another 6 months. And then he had stable disease for a surprisingly long period of time. So this 11-year-old boy was taking 1 milligram per kilogram of ivermectin daily for 6 months, and he had no side effect. His only therapy-related complaint was that he didn't like the smell. So no side effects whatsoever at 1 milligram per kilogram. This is very important because this actually gives you an idea of what doses should be used. Here's an article that was published in 2023. Now, this is not a peer-reviewed article. This was on thedesertreview.com, and it features experiences of doctors around the world who have used ivermectin at high doses and with certain cancer patients and how those cancer patients did. Very important was a report by Dr. Tess Laurie from the World Council for Health, who reported on a case she had of an ovarian metastatic cancer patient who took a fairly low dose, only 12 milligrams per day, and her tumor markers, her CA-125 levels dropped from 288 down to 22. Now, this patient was taking ivermectin with chemo, but had a shocking response to therapy. Then there's a report by Dr. Landrito, who reported a doctor colleague of his who had terminal gallbladder cancer. She was dying from gallbladder cancer, and she just started taking a high dose of daily ivermectin for 14 months, and her terminal gallbladder cancer completely resolved and disappeared. And so when you go into the details of this case, um, you find out that she took an extremely high dose for the first few months of 2 milligrams per kilograms per day. So here we have again that dose, 2 milligrams per kilograms per day, which we saw from the Gutso article that this is a safe dose to take. She experienced visual side effects for a few days, but they quickly resolved. So this was well tolerated at this very high dose. Then we have another report of a man named Oscar Nasu with a huge neck tumor and cannonball-sized lung metastases. He took high-dose ivermectin of 2.4 milligrams per kilograms per day for 3 months. The lung metastases shrank, and he no longer needed pain medication. He is now on 2.45 milligrams per kilogram per day and not showing any sign of overdosing or toxicity. This is the highest dose I've seen any person use. So this is an extremely high dose, but again, an anecdotal report of success on this dose. Then there's one more case here in this article, a 70-year-old man with prostate cancer that was taking 45 milligrams a day, so not a very high dose. This would be about less than 1 milligram per kilogram a day. And his PSA dropped from 89 down to 10. So I get hundreds of questions. What kind of ivermectin formulation should you take for cancer? Well, if you can get the tablets, get the tablets. They're importing them from India, they're getting them from Mexico. In the United States, you can get them fairly easily. In Canada, it's extremely difficult to get. The border agents will actually confiscate it at the border. I would recommend, or I would suggest 12 milligrams tablets, because 6 milligram tablets, you're going to have to take quite a few of them. So if you can get your hands on 12 milligram tablets, that's probably the best scenario. If you're in a desperate situation and you cannot get the tablets and you've basically been sent home to die, there are liquid versions of ivermectin. I never recommend veterinary products, but if I had a family member who was dying, well, this is something that I may consider. What you will find with the liquid versions is that each ml contains 10 milligrams of ivermectin. So you can think of it as each ml is almost like a 12 milligram pill, 1 ml, 1 pill, right? Now, these come in 250 ml or 500 ml, and they're not very expensive, maybe 100 to 150 bucks a bottle. So it ends up being very economical, especially people who don't have a lot of money. This is a very, very economical way of getting ivermectin. But the concentration is very crucial. Each ml contains 10 milligrams of ivermectin. In terms of the various types of paste formulations, again, I do not recommend veterinary products. Even something like this, they may have other additives that are not safe for human use. And in terms of the concentration gets really complicated. You may have to take half a tube or even an entire tube a day once you convert the concentration. So I would really not recommend this. Again, people may end up in desperate situations. And so, you do what you have to do. So we now come to the most important graph that I've put together in the past year, and it is the dosing schedule for ivermectin. I would suggest for most cancers, you want to be looking at 1 milligram per kilogram per day. That would be my starting dose for most cancers. And cancers that have been shown to work with ivermectin, there's many different kinds of cancers. You've got breast cancer, colon cancer, lung cancer, you've got pancreatic, renal cell carcinomas, gastric cancers. There's many different cancers that you can try ivermectin with, leukemias, of course. The one cancer I have not seen almost any research on with ivermectin is lymphomas. I just have not seen any papers talking about lymphoma and ivermectin. That doesn't mean it doesn't work. It just means that, there aren't any studies looking at lymphomas. This is the dose that I would start with. Dr. Shankara Chetty had that prostate cancer patient whose PSA dropped from 89 to 11. He used 45 milligrams of ivermectin per day. So when you think about the dosing, 1 milligram per kilogram, typical person is 60 kilograms. That means you're going to be using 60 milligrams of ivermectin per day. That's 5 pills of 12 milligrams each, or 6 ml of the liquid ivermectin. And 6 ml is basically 1 teaspoon. That is the way to think about it per day. 1 teaspoon per day, once a day. And there's been no report of long-term side effects with 1 milligram per kilogram. And there was that study by Castro looking at children who were taking 1 milligram per kilogram they had leukemia over the long term with no side effects. You can start lower. Dr. Tessalori reported a case with a much lower dose. This dose was actually 0.2 milligrams per kilogram. And there was still an improvement in ovarian cancer with the blood markers, the CA-125 levels dropping from 288 to 22 after 2 months. So there is anti-cancer effect. It is dose dependent. There's evidence that the anti-cancer effect of ivermectin is dose dependent. So higher dose, you may get better efficacy. Now, if you have extremely aggressive cancers like leukemia, pancreatic cancers are extremely aggressive, and brain cancers. Now, there is some question about, does the ivermectin cross the blood-brain barrier? It does, because you do get neurological side effects, but it doesn't cross it very well. So for brain cancers, you actually may need a higher dose, like 2 milligrams a kilogram. And again, this is the case of Dr. Landrito's doctor colleague, who had that terminal gallbladder cancer. She took 2 milligrams a kilogram a day for 14 months, and her cancer disappeared. She had some visual side effects, but then those went away after a few days. Now, the highest dose that I've seen is 2.5 milligrams per kilogram. Mainstream oncologists will not even offer you ivermectin. So this is as far as some people have pushed the dosing, 2.5 milligrams per kilogram. Again, Dr. Shankara Chetty had a patient on up to 2.5 milligrams per kilogram per day without any long-term side effects. So at 2 milligrams per kilogram or 2.5 milligrams per kilogram, you might get some visual effects, but they don't seem to last long-term. They only seem to last a few days. I would suggest for most people to start at 1 milligram per kilogram, and then depending on your personal situation, adjust from there. You can always adjust upwards. So that pretty much covers it. Using ivermectin in cancer is honestly very straightforward. 1 milligram per kilogram per day is your typical starting dose. If you're using the pills for a 60 kilogram person, that's 60 milligrams a day. That's 12 milligram pills a day. If you're using the liquid version for whatever reason, that's 6 ml per day. That's a teaspoon is 5 ml, right? So that's basically a teaspoon a day of the liquid ivermectin. And that's it. It is a very, very safe drug. It is off patent. You can get generic versions of ivermectin. No one's going to make any money off it. And there are no clinical trials right now looking at ivermectin in cancer because there's no money in it. So I really strongly suggest, if you are struggling with cancer, look into ivermectin at a starting dose of 1 milligram per kilogram per day. You take it as long as there is evidence of active tumor. You can take it for months. In the Castro study, those children with leukemia were taking it for 6 months. There are anecdotal reports of people taking it over a year on a daily basis without any long-term toxicity or side effects. So that'll be it for this video. I'm going to have an extensive series of videos on the treatment of cancer. So thank you very much for listening and for your interest and for all your comments. And I'll see you in the next one.